She was born at 39 weeks, healthy, and it was just amazing to be able to hold her right away. There's nothing better than that.
It was a wonderful feeling to be able to take my daughter home, because my son had to stay in hospital for 3 months. So being able to bring her home was like great, and she was perfectly healthy, like nothing was wrong with her.
These two mothers are among Ohio families who have firsthand experience of the benefits of progesterone and its results in helping mothers deliver full-term babies. Yet, for many mothers across the state, getting progesterone and finding resources to help them navigate through the barriers can be difficult.
At first, the insurance company, I guess they really wanted to know what it was actually for and why I needed the shot, so for them to have to pay for it. So once my health coordinator at the hospital actually reached out and, told them like her baby will make it and have a chance.
Not easy walking around in this heat when you're pregnant, huh?
Barriers to obtain progesterone at the right time in a pregnancy are real, and for many mothers, the barriers can be significant. Physicians, nurses, social workers, and pharmacists work behind the scenes to minimize barriers and promote easier access to progesterone. Barriers include late entry into prenatal care, getting pregnancy care after 12 weeks gestation, the cost of progesterone, availability of generic or other cost-effective forms of progesterone, insurance coverage, lack of coverage, not enough coverage, losing insurance during a pregnancy, approval and processing issues. In Ohio, there are 5 different Medicaid managed care plans, each with its own protocols and policies for progesterone. Administration barriers, lack of options for receiving weekly shots versus a daily suppository, in-home care versus weekly doctor visits. Transportation, getting mothers and sometimes their young children to and from appointments each week. Lack of understanding about progesterone and its benefits. Consider this: Ohio has one of the highest infant death rates in the country. Preterm birth, babies born before 37 weeks of pregnancy, account for 3 out of 4 infant deaths in Ohio. If families have had a preterm birth before, progesterone can decrease their chances of having another preterm birth by as much as 40%. Progesterone is safe for mothers and their babies, and is considered one of the best ways for women who have had a spontaneous preterm birth to help their babies grow to full term.
Once my insurance finally cleared or whatever, it didn't even take long. And she came every week, she gave me a shot, and because of that shot, my daughter is here.
If they can just get in the door, then we know where to send them. We can get them to financial counselors. We can help them sign up for insurance. So that's the biggest piece.
I think every pregnant woman should have access to progesterone, no matter what insurance they have.
Finding ways to remove barriers and helping mothers gain access to progesterone are key in helping to prevent premature births and infant mortality in Ohio.
Any history of bladder infections, kidney infections?
While there is much more work to do in this area, the healthcare community, through the Ohio Perinatal Quality Collaborative and organizations that serve pregnant women, clinics and public partners across the state are working to create more access to proven therapies that help families carry babies to full term.
We've got 3 beautiful children, 2 of which are here because of progesterone. There's
there's a lot to that.
It's the joy of that and the sense that they're just healthy and everything's okay.
Wish I would have had it the first time with my first child. The progesterone shots were, they were just, I felt like they were amazing. I feel like they're really the reason that my daughter didn't come earlier than she did. So, and if I had to do it all over again, I would do it all over again.
To learn more about how you can help reduce barriers to accessing progesterone and help women carry their babies to full term, visit the Ohio Perinatal Quality Collaborative website at www.opqc.net.